Hey there, I'm Lara. I want to help you with your happy knees. Now, physical therapists sometimes call the knees the dumb joint, which sounds really not very nice. But what it's really revealing is the knee is just it's moving because somebody else is telling it to move. It doesn't often think for itself. And so when your knees feel less happy, it's usually because the directors of that movement aren't doing the best job. And the directors are coming from the hips primarily, but also from the ankles. So learning how to triple flex, which is flexion at the hip, the knee, and the ankle, will really set you up for happy knees. Because a lot of knee injuries or overuse or crankiness, if it's not like an acute injury, it's often because of poor mechanics or suboptimal mechanics coming from the hip or ankles. So first, come to a wall and establish a good posture, because this is important. If your posture is a little bit offset, look at what will happen to the knees. They're going to be offset as well. So I want the posture to be the most optimal. There is no perfect posture, but there is a range of optimal. And the way you can get into that is use a wall, find the back of your skull or some part of the skull, some part of your shoulder blades, some part of your sacrum. The sacrum is right above the tailbone, okay? You got the crack, the tailbone, the sacrum. That's the sacrum. The lumbar spine is the arch away. So we're going to put the feet are away from the wall, put the sacrum on the wall, scapula on the wall, and skull on the wall. So there is our alignment that we want for a neutral pelvis and a neutral spine. A neutral pelvis sets us up for better movement in the hip. And remember what I told you, this is the operator, it's directing the knee. So if it's doing its job well, the knee will not take any brunt of the work. So I'm going to hold this, keep the knees soft, and begin to march. Now your feet might be quite a bit out, that's fine, but I want to feel that I'm moving at the hip joint. It can be smaller than this. You could be leaning way back, almost like a wall squat. But what we're doing is seeing how to move at the hip, flex at the hip, and that nothing on the wall, that triple S, isn't affected by that. So if you find that really hard, bend the knees more and then barely lift. So I'm really getting the feeling of hip flexion. You'll feel when you're moving in the pelvis because you'll start to tip. Some part of you will come away. So this is a way of practicing that. You can straighten your knees more and get it. So put this in your brain mapping, meaning register it and walk away from the wall and try and maintain it. Then you're going to train yourself triple flexion. Hands on your thighs. I'm going to get pretty robotic here and not move in my spine at all, but move in the hips. Imagine you're standing in front of your island, your kitchen island, and you're going to just dive over the island. Here's the island counter. It's pressing you back. You're kind of diving over it, and then you come back up. This is flexion at the hip. And what you can see maybe is when I'm flexing at the hip, my knee is executing the action that it needs to. It has to bend, but it's not being driven in a way that I don't really like, that would feel too much loaded. And that would happen if I start off an anterior tilted pelvis, bent, I run out of room, it goes into my knee. So learn how to flex here well. So sliding your hands and coming back up. This is flexing. If I get even lower, look, I'm going to start to get more into the ankle. My knee continues to bend, but it's being directed by the hip, and then the ankle helps out. So this is our triple flexion. And if you don't quite have that, just make the movement smaller until you really get it driven from the hip. If your ankle has lack of range of motion, focus on the downward part here. Put your hands around the ankle and just stay there, keeping the heel down, keeping your hips back. Think of like a downhill skier. Now step your right foot back, coming into a low lunge. So we shouldn't feel anything in the knee if the pelvis is neutral. You might feel some tugging if you have a lot of tightness in the front of the hip. So you can't always put a block underneath it or something. But just get this sense of holding here and make your fist and bring knuckles together. So we're going to move in the thoracic spine, twisting to the left and not moving in the pelvis. So again, the pelvis will impact the hip will impact the knee. So we have to kind of look at everything here. Last time, twist to the left, right hand to the floor or a block. Lift this right leg up off the floor, keep it lifted, and you can add a twist if that feels good. I'm not leaning too much into the left knee, and I'm lifting into the right hip, supporting the right knee. And take a breath here. And then I'm going to take a side lunge. We do a lot of these in my lit classes because they're so great. They're opening some of the muscles that attach from knee to the pelvis, hinging into the right hip. And you can stay here for a couple of breaths, keeping the spine long. Watching the knee, again, it's not that the knee can't go over the ankle. We don't want to move it over the ankle in lieu of the hip not moving well. Come back around to the front, step your right foot parallel to the left, and let's do a couple more of these. Slide up and down, slide it down. And it's really nice to video yourself because sometimes you won't know where you might be tipping or rounding that would be pushing into the knee until you see it. Last time we'll stay down. Left foot slides back, taking us into this tight 90-90, left glute on, pelvis neutral, skull is neutral. So we want to keep that triple S in effect. Knuckles come together. Firm the left glute, inhale, exhale, twist right. Inhale, exhale, twist right. This kind of movement, we wouldn't think. Why is this going to help our knee? Because it's helping our hip stay strong, our pelvis stay neutral, and that helps the knee. Last time, stay at the front, left hand down, floor or block, left knee up. Look how I'm not sinking. I'm holding the pelvis lifted, and the right arm can come up. Lean back away from the right knee. Keep this left hip lifted and breathe there. So the hips are, one hip is right now extending, this back one, and this one's flexing, and the knees should not feel any of that. Come around to the left side lunge. We'll bend the left knee, check in that the ankle, the heel stays down. We're sitting back into that left hip, opening into that right inner thigh. Should feel really nice. Last breath there, and then come around to the front, step your feet again parallel. Just 4 more of these, slide up, and you can feel the glutes kick in here at the top a lot. You can always bring your hands to the front of the pelvis to make the glutes come in. Finding, again, that triple S like you had on the wall. And last time. And then you can always try marching like you did on the wall and seeing, can you hold this in position that you're not tipping or rounding. So again, the mechanics of the hip really directly impact the knee. So if sitting like this feels really sucky for you, go to the hips, go to the ankles, see what's happening there, see what's happening in your posture. Work on your triple S. I promise it'll keep your knees happy. Until next time, keep moving.